My name is Johan Dennis. I'm a medical doctor from Belgium. I have only one key message, that we are in a sort of gigantic smoke screen of misinformation. It reminds me of my childhood when all children believed in Santa Claus. And it was a sort of orchestrated thing, because everybody worked with it. So the children believed it. And at a certain moment, they are confronted with the truth. And some children are very angry then, because they have been fooled all the time. And my key message is that what is happening now with COVID is a gigantic smoke screen. It's a sort of false flag operation. It means that if you want to put an agenda through, for example, mass vaccination of the world, you have first to create a situation where everybody is in fear for something that is there. But it's not true. There is no medical evidence. There is no urgency at this moment. But the people are put in fear all the time by the media. I recommend everybody to do his homework and to put out their television and to speak with each other and to listen to alternative media where people like me and others are speaking. So my only plea to every citizen in the world who values his humanity and is responsible for himself and for his children and for his co-citizens is to please do your homework, put out your television set and do your work and visit other sources. And then you will be like a little child where you see that Santa Claus was a lie.
My name is Renate Tillema. And I am a psychiatrist and I'm working 24 years now as a doctor. What's happening now is really, in my opinion, a very aggressive attack of our government. I'm from the Netherlands, but I can see it worldwide. The message I would like to send today is that we have to stop this aggressive attack to the people. And we only can do that together. We have to say, okay, stop, it's enough. Because if we don't, they will go farther and farther and take all our freedom. Our freedom and the freedom of our children. The first question is, if you are really scared, about what are you scared? Are you scared about the virus? Are you scared about the measures? Are you scared about, I don't know, whatever? But start asking yourself questions and then get an answer to that and ask yourself what's important for me in my life. And what do I want to have for a goal in my life and how would I live my life? You know, I'm a psychiatrist, so I see a lot of people with depression, anxiety, and most of them are worsening. But also I see people who are getting in the fighting modus, but also that they are getting lonely because their social networks are diminished. And it's for them all very important that they can have the social network, because as a psychiatrist, I know that patients have problems with that. And they need the social support, but they are getting lonely and isolated. If you are a patient or not, or if you are healthy or not, we have to be there together and to make a statement to the government that we have enough of it, that we want to have the rule of our own life. And we don't want to have a vaccination, or we don't want to have our freedom taken away from us.
What I would like to share is that I think that we are at a bifurcation point in history. It's about your existence.
Yeah.
It's about the existence of your children and your grandchildren, as the previous speakers told us. And that is of the essence. There's no more pressing issue at this moment. My biggest takeout, I'm not alone.
Yeah.
That is very encouraging for all the watchers or all the people in this program to see that they're not alone. That when they speak out, there are many, many people around you who also have this innate drive for health, mental, physical, psychological, spiritual health.
I want to stimulate people, just be healthy, go for a walk, relax, do the right thing, eat your vitamins, be proactive. And vaccination is not not especially not the vaccination, which has no time to prepare. Because which, well, all these criminals in jail, and we get back into a society which is more honest.
Well, I'm a GP for 35 years, and I've always learned that love and touching important is for recuperation, getting better. And now I have to stop that. I'm feeling ridiculous in my office behind plastic walls. I was so angry about the fact that doctors all over the world who had accomplished wonderful things, like this Dr. Scott Jensen in Minnesota, who got this degree of Doctor of the Year of the whole country, and he is senator of Minnesota. And he had to quit talking about this subject because otherwise he would have to leave his profession. There is this example already in Holland from a woman who is who got a letter from the inspection of health in Holland, and she has to quit her job if she repeats that. Step by step, show people the facts, because the facts are that this virus is not a killer virus. They are putting in one statistic, in one line, the figures of until the 1st of June, and that were mortality or figures or people taken in the hospital. And now they're showing there is a second wave coming, but it's only the number of people getting, not even infected, who have a test positive. Meanwhile, we know that these tests can't be trusted, cannot be trusted. You can only use them if somebody is ill. You can use this test to accept that maybe, okay, this will be probable that it can be the reason. Not even sure. These tests are not 100%. You can't make a conclusion out of that. And people are released. We can walk everywhere. And even if you're not ill, you can go to these testing streets to get yourself tested. So that's exactly what we want, this second wave. Because it means people have been in contact with the virus and they didn't get ill, because the same figures from RIVM, that is our CDC, shows that there are no extra deaths. There are no extra people taken in the hospital. So, you see, I'm getting a bit angry about it. Why are we not correcting this in the media, that people should be glad with the second wave, which they show that's not a second wave of illness, it's a second wave, how we show that people luckily have contacted this virus and didn't get ill.
I'm Michele Schippers. I'm professor at Behavior and Performance Management at Erasmus University in Rotterdam. And I did some research on the side effects of the COVID-19 measures. And I found some disturbing results from these measures. In the West, we had a lot of lockdown measures, and then a lot of supply chains were halted. And this will result in 138 million people dying from hunger in the upcoming time. And of course, a lot of medical care was halted, so 28 million surgeries were stopped or cancelled or postponed. And this is just a few of the effects. There are many more, like depression and anxiety tripled. So I started wondering if this was good for humanity, or what we wanted to achieve with this. Because I can't imagine we want to achieve like many people dying from this. 138 million people dying from hunger. It's not something you want. Somebody will strive for, I would say. Well, it is reported in the press, but you need to seek for it. And I was so Yeah, I'm not sure. I was like, this is the biggest humanitarian disaster in the history of mankind. So more people will die from the lockdown measures than in World War I and II together. But it's not news. So in the mainstream media you won't find it. You will find some reports, like the United Nations and other organizations. They have said, okay, something's going on here and we need to fight this. But I think in a few months' time, and you will see this play out, and then they say, hey, can you give money for people dying there? And then I'm like, and 60 million people will be out of job, so where's the money coming from in the European Union alone? So 60 million people, about 50 to 60 million people in the United States, 110 million in India. So what are we going to pay everything from? That's one of the questions I have. What can we do? First, inform yourself. I think you need to know what's going on. And don't look at the mainstream media too much, but feel in your heart, because I felt something was wrong. And from that gut feeling, I started to do research. And then I got really scared, not of the virus, but of the effects of the lockdown measures that we are taking. So, and if you think to yourself, what is this a future I want for my kids? I have parents writing me that if I would have known that this would have happened, I wouldn't have taken any kids. And this was a father of 3 kids writing me. And I was shocked, like, whoa, I can imagine that he thinks like this. But what needs to happen that you even start thinking that the kids you already have, should have brought them into this world?
I'm Chris de Vries. I'm a dentist in the Netherlands. And I'm 34 years old. I have 3 children. When I look at Australia and New Zealand, what type of lockdown they are forcing on the people, I'm very, very, very afraid of that happening again here in Europe, because the measures are way too hard. The virus isn't that dangerous. It's a severe flu, or maybe less, when you look at the data. And Michael Levitt explained that very, very clearly. So we have to think and not to be afraid. Look at another type of media than the mainstream media, because they are not telling the truth at the moment, and I do not know why. I think they are corrupted by the politicians who are paying them. But it's a very, very serious crisis.
My name is Herman van Nauhuis. My profession is dentist, and my concern is, can I be dentist? Can I be that? In this time, I have no future as dentist anymore, but because I'm 73, so I will stop once, but I think for my children and my grandchildren. And what struck me here is the way they talk here. I feel the heart bouncing here in this room, and that gives me a very good feeling. But what you hear is heartbreaking. It's unbelievable that so few people know this because of, well, let's say, the mainstream media. We are poisoned, I think, with words. What makes people fearful, anxious, and there is half truth, half lie. Well, that's the most horrible lie, actually. And I think that what Gaston Corona said, that the whole truth is not the truth if there is no freedom in it. Well, that's that's what I'm saying. If there is no freedom in the truth, then that's not a truth. So my truth is not the truth. And I say, well, you are free to believe your own truth. And because of that, we can come along together. And when there is one truth we have to believe because of, and if not, there's violence, then you know that's not the truth. I can understand that people don't want to look at it because it's dangerous. And so it's hard to say, but I say, well, just listen. Just listen to people who are have the courage to speak in spite of all the consequences. Because they are brave. They have no money. They have just a voice. And I think immediately on the Chinese guy who was in front of the tank in Beijing. And that was so impressive, that a guy like that in front of the tank, and we saw that. I cannot say, well, go for the tank and give your life for it. But it's inspiring that, you know, if you just in yourself stand up for what's okay and don't say yes to a lie, that's enough. I hope that people can do that.
I'm a medical specialist for elderly people, elderly healthcare. My profession is to take care of elderly people in nursing homes. And I'm here because I want to speak out. I want to hear the truth. I want to ask questions. I want to know what is going on. I cannot do my job in the way I would like to do it. That means to take care of the elderly people and the vulnerable people in the maximum quality that what they need. I'm restricted by rules which my government tells me to do because of a virus. The virus was between March and May, and we're in the summer now. We're going into the autumn, and there's nobody ill. There's nobody in the hospital. Even our elderly people are okay. We should have a rest. We should have a boost on our immune system, and we're stuck into rules. We're hitting each other behind mouth mask. We cannot breathe. We cannot hug each other. The most elderly people need is the hug and the love from the people who can give it to them, which is the children, the family, and we're social distancing. And we're just, the lines are cut off. We need love. In your heart, you know that something is wrong. And I'm not completely aware of the whole truth, but at least I'm searching for it. And I think we should unite as a group of doctors to search for the truth, to search, is this virus really a threatening virus, or are we being fooled? Is this a lie? I want to know. I think a lot of me and my colleagues want to know. There's a lot of people died, like in every flu season, and also a lot of people died who also had underlying disease. And the people who are lost, I really feel sorry for them. But we also have to save the people who are still alive. And the disproportional measurements now are making more damage than trying to protect the ones who are vulnerable. We make the strong people vulnerable now. Everything should be in balance. And we should be able to live normal again, without rules. We want our freedom. We want to breathe. We want to love. I want to be human. I want my human rights. And I want my patients to speak out what they want. They do not need a lockdown to be happy or not to become ill. They also have a voice.
My profession is I'm an engineer, but besides that I'm a medical investigator because I got cancer 12 years ago and I cured myself. I found myself that you have to ask the right questions. If you don't have the problem, well established and you're trying to solve it without actually really knowing what the problem is, you come to solutions that don't work. And I think this is the case with our present governments. They are trying to solve a problem that was opposed maybe to them as a problem, and the solutions that they have at hand are not working for the population. So of course the population feels terrified by what is going on. So we should, as Sven also said, try to help our leaders in finding the right way out of this chaos. And again, for me, this begins with asking the right questions. So what is the problem? When you understand what COVID actually is and what is threatening us, then you can start working on maybe a medication, maybe a communication, maybe a task force that digs deep into anything that helps us to cross this line and start taking up our normal lives again. And the second question that I think should be answered, if we run into an illness, like I have with cancer or any other illness, do we really want to trust anybody else with our health? Or do we want to take responsibility for our own lives and for our own health? And isn't that the basic right of any human being to decide about your own life, your own body, and decide what you think is good for you, instead of other people deciding for you what you should do or what you should take? This places a very big burden on an individual. I've experienced that myself because it places you outside of the herd and outside of the group, and you get criticized a lot, and this gives you a lot of troubles and a lot of anxiety and so on. But I want to tell people there's always an alternative. And what we see in the present COVID situation is that we are played upon choosing sides. If we allow ourselves and allow other people to speak from the heart and to investigate what they really are trying to say and take a minute and take some time and get into the proximity of another person, then we can solve anything. So I'm very thankful that I was part of this, and I hope the world will listen and follow up on some of the great advice that we've got here today. Thank you.
I'm Alexander van Walraven from Holland. I'm occupational medicine, and I would like to say something about the situation on the earth at this moment. First of all, what I was noticing was that when COVID started, it was really strange to realize that you have a very good justified reason to make a lockdown. And I always was wondering when comes the big answer about the question, what is the mortality rate? Because if you make a lockdown, you will need a very good reason, because it costs a lot of money and really a big results. And that was my question. But it was not coming. And in fact, we know all now that the mortality rate is not so big at all. And that made me angry, and I couldn't say anything. And I was really hesitating about my feelings and about my thoughts, and thought, oh, well, wow, is it me? Is it me is not seeing it right? And then with my colleagues, I discussed it. And you notice that there are two ways of thinking. One way we follow the leader because they will know better, and the skeptical like me say, well, no, it's not right, because we have a mortality rate what is not as big as a flu. So why do we now do this lockdown? Because and with other diseases we don't do anything. So why now? I still not have the answer. And I think it's really surprising me that so many people had the same questions and are hesitating like me. It was really a relief to notice that people are thinking the same and have the same facts. So I really want to recommend people to do some research for yourself and really feel and notice and don't hesitate at strange thoughts, because it's a real strange situation, a real strange life at the moment, and everybody is confused. The puzzle is coming together, and I think we are in the beginning of a fight, and you can wonder for yourself, what can I do about making life again normal again, and not a new normal, but old normal, just the way it was. People have to learn to think for themselves, to know what the truth is, and now is the chance to do it. And we made a start with this with all the group, and all the groups in the world, because we are not the first and not the last. And for the Holland, it's just the first time. And we are really planning to make this a whole movement in the world. And people has to really know the facts, to learn facts, ask questions, make a dialogue with each other, dare to wonder and ask questions. That's really important.
I would advise everyone to look into it very seriously, and not just the official narrative, but also all the other stories that you might at first hand, in first instance, think that it is a conspiracy theory. And of course there's also a lot of nonsense out there, but don't put it aside immediately, sleep over it, read it again, maybe wait a week, see it again, and draw your own conclusions, and don't blindly follow the official rules. My biggest wish is that we go back, or maybe forward, to freedom and hope and universal love in a society that lives together in harmony. It is not necessary to stay home in fear, because a human body is very, very resilient. And if something does happen, if you do get sick, that is for a reason. And it's usually something has to do with shortages, food shortages, and also maybe exhaustion by other reasons. It's this paradigm that illness is a hostile thing that you have to fight and conquer, and I think we should go to the realization that disease is something. It's a signal. And when you go to the garage with your car and there's a red light, and you say, there's a red light there, I don't trust it, and the garage, the technician comes back with a hammer and smashes out the light, and he says, okay, problem solved, I don't think you would pay him. Probably you would sue him. But this is what is often done in medicine. You have a skin problem, and they use cortisol, or you have an inflammation and they use antibiotics, but they never ask or wonder what it is in the system that it produces or that it's vulnerable to this condition. And especially when it happens over and over again, you should start realizing, okay, there is something that you're doing wrong, and it's a warning light. There's something you're doing wrong, and you have to look into the cause of that. Society has been building up to this with vaccines, especially since Second World War, and they've been adding more vaccines over and over, and even in 1990 here in Holland, they started with the BMR or the MMR vaccine. And I remember having these diseases as a child. So I brought my baby in there, and I thought, why are they vaccinating? Is it so dangerous? Because that's what you're told. These are dangerous diseases. And it's not true. These diseases weren't that dangerous. There are always risks, but also medical treatments have risks, and they are downplaying the risks or even denying the risks of vaccines, and they are increasing or blowing up the risks of diseases that are easily treatable, normally are easily treatable with fairly simple ways. The push for ever more and to demand a 95% coverage of vaccinated people. So it's getting more and more. So I realized, well, this is leading to mandatory vaccination worldwide. If you look into all of that, that's just where it's going.
I am Annemarie van Rij. I came here to share the motivation to become more, to get more confidence in what is going on, and not longer to live in fear. That's for the elder people so disastrous. It is, and for the children also. I would like to see children live in a healthy freedom and not in fear, and that they will not be excluded when they are not vaccinated. The law that is coming, that it is important for all the people of the Netherlands to know that when the law is accepted, we are going to a dictature and not longer living in a democracy. And that is not known by all the Netherlands. Be aware what is going on. It looks like our Prime Minister, he does look like he has the good things to do for us, but it's the opposite.
I am Hilde de Smet, and I'm a medical doctor, and I am one of the authors from the open letter in Belgium from Docs for Open Debate. And I just want to tell to the people that there is so much censorship at this moment, even in the European Communion. They want to make a law of this so that it's allowed to fight against what the World Health Organization calls the infodemia. It means that every information which is not according the official guidelines can be removed from the media, social media, and etc. And in social media, we have seen this for months, that everybody who's viewing a different, who's saying a different point of view is removed. But also in the mainstream media, we see that there's always the same things, the numbers which are not compared to other mortalities, other epidemics like the flu and so on. So I just want to call you to inform yourself. And we tried in this letter to give a lot of information, also check the references, go and find information on alternative media. There is so much, and it's just too important to know that there is also another side of the story. Well, for me personally, the most difficult topic is the censorship, because we don't say we have the truth. You know, the truth always has different aspects, but as long as only one voice can speak and the other one cannot go against it, then we never can get a good decision. And the problem is that I think 90% of the people just believe what they're being told. And for example, there is no second wave. If you look at the numbers, okay, there's an increased number of testing, but the percentage of people being positive has not increased. So it's just because there's more testing that there are more cases. But if you look at the hospitals, if you look at the mortalities, the hospitals are empty. It's incredible, and still the media says that, as the second wave, and everybody has to be careful. At this moment in Belgium, in many places, it's obligated to wear a mouth mask. Even in some cities, when you go walking into the park, the children have to wear it in school, the adolescents in high school. And it's just ridiculous, because even about mouth masks, there is no evidence that it can make a difference. And so I just want to call everybody to remain critical, to feel for yourself, to judge yourself if what is being told to you, if that compels to you, and if you feel like, no, it's not okay that my child has to wear a mouth mask from the morning until the evening, that you don't wait for others to solve the problem, but dare to open your own voice and say something. And I think what I liked most was the community, the connection with other medical doctors, and also the lawyers. I think it's important that we kind of know that people are trying to make a difference and not just allow this to happen. But when you see that there are worldwide other initiatives, it gives a kind of courage that you're not alone, because now at this moment we do have quite some signatures yet, but still you're just like a small part of the whole group who, although I do believe that there are a lot of doctors, if they think a bit logically, that they know that all those measures are not okay, but I also think many are maybe afraid, or they don't want to do it for their colleagues or to lose their job or whatever. But anyway, at this moment, the ones who speak out are just a minority. And so today was nice to connect with other people, exchange information, and so on.